Hi class, this is my video for the SOAP Note case presentation week 13 discussion board. So for this patient, she's reporting to the clinic with complaints of lower abdominal pressure and urinary frequency. For history of presenting illness, patient has presented to the office 4 times over the last year with complaints of dysuria and has been treated for UTI at each visit. She states that she feels her UTI symptoms are occurring within 12 hours of sexual intercourse. So for the GU section, when I'm doing my assessment, my subjective, I'll want to ask the patient, she says she's having urinary frequency. I also would want to ask the patient about any burning with urination, any hesitancy, if her symptoms are primarily associated with voiding or are they more continuous throughout the day. I also would want to know if she's having, or if she's had noticed any blood in her urine, or if she's had any unusual vaginal odor or discharge to kind of differentiate between the two. Also noting any fever, chills, fatigue in the assessment as well, questions associated with that. So after going through everything for this patient, diagnosis UTI. So for pharmacological treatment, 5-day treatment of nitrofurantoin, 100 milligrams BID for this acute UTI that she's currently having. And then since she's had 4 within the last year, she does qualify for being on prophylactic treatment. So then I would do this current treatment, the 5-day treatment, nitrofurantoin, 100 milligrams BID, and then moving to a 50 milligram nitrofurantoin taken daily, or within 2 hours of sexual intercourse if she is having sex that day. Non-pharmacological Tylenol, ibuprofen, OTC as needed for pain. Cranberry supplements, probiotics might be helpful for this patient as well. She can try those things. Diagnostics today, urine dipstick analysis, culture with sensitivity, and UA. I don't think that there's any need for her to be referred to a urologist at this time. I would want to see how my acute treatment of the nitrofurantoin and then the prophylactic treatment does for this patient. For follow-up, I would want to see her in a couple months. For the acute treatment, if it's not corrected within 24-48 hours, she can call. We could discuss another treatment option. Just keep in mind her allergy to Cipro. But it should clear up in 24 to 48 with this acute treatment that I'm doing, this 5-day treatment. If not, have her come back. Otherwise, like I said, I'd like to follow up in a couple months, maybe 3 months, see how she's doing, if she's had any symptoms after intercourse with the new prophylactic antibiotic treatment. And then just keeping in mind, of course, patient education, need to discuss voiding practices, voiding at first urge, voiding always after sexual intercourse, seeing what she's been doing in the past. Maybe she hasn't been doing any of this, and that's kind of contributing to her UTIs that she's having now. Of course, adequate hydration, increased water intake throughout the day and night, advising the patient to wear cotton underwear, avoiding baths, hot tubs, things like that. Of course, practicing safe sex, wearing condoms, continuing her birth control that she's currently on. Reminding the patient it's important for her to finish this 5-day course completely for her acute UTI and then move to the prophylactic method of treatment. And then really discuss with her why we're doing this prophylactic treatment, as this is her 4th UTI that she's had within the last year. So that is my workup for this patient, and thank you.